Have you ever wondered how doctors choose the right antibiotic for an infection? It's not guesswork. Labs run antibiotic susceptibility tests to guide care. These tests tell clinicians which drugs will likely kill or stop a specific bacterium, improving outcomes and avoiding ineffective treatments that waste time and harm patients. Accurate testing reduces unnecessary antibiotic use, limiting side effects and slowing the rise of resistance that makes infections harder to treat over time. Today, we'll explain the key concepts and common methods, how labs grow bacteria, test drugs, measure inhibition, and interpret susceptible versus resistant results. Let's begin with the basics, how we get from a sick patient to a lab culture ready for testing, and why sample quality matters. First, identification. Labs identify the bacterium from the patient sample, so testing targets the correct organism. Not every antibiotic works on every species. Next, selectivity. Antibiotics vary in which bacteria they affect. Selectivity means the drug targets the pathogen, while sparing other cells or organisms. Minimum inhibitory concentration, or MIC, is a core concept, the lowest drug concentration that stops bacterial growth in the lab. MIC gives a numeric value clinicians can compare to breakpoints to decide if an organism is susceptible, intermediate, or resistant to a drug. Disc diffusion is another common method. Antibiotic discs placed on an inoculated plate create zones of inhibition where bacteria can't grow. Both MIC and disc diffusion are standardized so results are reliable and comparable across labs, using clear procedures and control strains. Let's walk through disc diffusion. A uniform bacterial lawn is spread across an agar plate to create consistent growth for testing. Antibiotic-impregnated paper discs are placed on the surface. Each disc releases drug into the agar, creating a concentration gradient. After incubation, bacteria grow except where the drug concentration is inhibitory. Clear circles, called zones of inhibition, indicate drug activity. Technicians measure these zones. Larger zones generally mean greater sensitivity, but standardized charts translate zone sizes to susceptible or resistant calls. For MIC testing, labs use dilutions or automated devices to find the exact concentration that prevents growth, producing a numeric MIC value. Automated systems can speed testing and report IMCs quickly, while manual methods remain important in many labs for confirmation in unusual organisms. Results are reported as susceptible, intermediate, or resistant based on standardized breakpoints set by experts and health agencies. If an isolate is susceptible, clinicians can confidently use that antibiotic. If resistant, the drug likely won't work and should be avoided. Intermediate results mean response may depend on drug dosing, infection site, or whether the drug concentrates where needed, prompting expert judgment. Clinical context matters. Test results are combined with patient factors, allergies, drug side effects, and infection severity to choose the best therapy. Rapid testing and good lab clinician communication can shorten time to effective treatment, reducing complications, hospital stays, and inappropriate antibiotic use. When labs report resistance, infection control measures may activate to prevent spread, protecting other patients and preserving antibiotic effectiveness community-wide. Susceptibility testing is a cornerstone of antibiotic stewardship. It helps prescribe effective therapy and avoid unnecessary or broad-spectrum antibiotics. Using targeted antibiotics reduces side effects for patients and lowers selective pressure that drives resistant strains to emerge and spread. Clinicians rely on timely lab results. Faster tests and careful interpretation mean better outcomes and fewer unnecessary prescriptions overall. For patients, follow instructions. Don't demand antibiotics for viral illnesses, and trust clinicians who use lab data to guide treatment decisions. In summary, identify the bug, test its susceptibility, interpret results, and choose the narrowest effective antibiotic to protect patients and public health. Thanks for watching. Effective antibiotic use starts with good testing. Talk to your clinician and support stewardship that preserves antibiotics for the future.